Back to the Dean Obeidallah show. Right now, very happy to have back on the show Dr. Bhadelia, the founding director of the Boston University Center for Emerging Infectious Disease Policy and Research, a board-certified infectious disease physician, associate professor at BU School of Medicine, and a former senior advisor to the White House. And she was on our show before. Good to see you again, doctor. Thanks for being on.
Thanks for having me, Dean.
Sure. So let's start with something very basic. Are vaccines good at saving lives, especially of children?
Vaccines here in the US alone, when you look at a CDC study, it said between 1994 and 2023, the kids that we vaccinated in that period of time helped the US save 1.1 million lives and $540 billion in healthcare and hospitalization costs. They are undeniably one of the greatest achievements in both medical care and public health in the last few decades. The way we've rolled out the mandates in schools in particular has allowed us to get the level of population coverage to the point where they're become a victim of their own success. We don't see those childhood diseases with as much frequency.
And I obviously asked that because of RFK. Let me just ask you to take one step back. You were on in March, and we talked about your concerns, what RFK Jr. might do as Secretary of Health and Human Services. Has it been what you expected? Has it been better? Has it been worse?
Good God, it's so much worse. I feel like there's like a multi-sector attack on science, public health. And, let's just start with the public health part. You started with all these just cuts across not just CDC, 2,400 people are cut in April. They had to rescind 800 more. So just creating that confusion of are you hired? Are you not hired?
Right.
They've cut entire divisions of CDC, including the Global Health Center. Bad idea, because now there's an Ebola outbreak going out in the Democratic Republic of Congo. And, what's going to happen? What's our readiness? What's our intelligence? They have, the NIH has given out, I think it's in the first 110 days, they give out $2 billion less than they did last year. And they've stalled $8 billion more in scientific sort of grants that already were given out. They have cut the investments in new vaccines, the 500 million for mRNA vaccines that were given out. One of the most promising technologies, Dean, in helping us not just stay ahead of just endemic diseases like flu and COVID, but also if there's something else on the horizon that we need to worry about. The rest of the world is going to continue investing in these things. And all of that, the biggest thing that bothers me is everything the Secretary Kennedy has done is exactly what he has said his entire life he's going to do. He doesn't believe in vaccinations being an effective intervention. And he has his work so far at the HHS has both worked to reduce access to vaccines and to increase distrust in vaccines.
Yesterday, he testified before the Senate, and some of the things he just was very evasive. But there were certain fact checks, like ABC News fact checked him. He said current vaccines have not been studied in placebo-controlled trials, and ABC News said that's just not true. And they went through it. What can you share? And why would he even bring this up? I mean, no one's walking around going, "Are they tested in placebo-controlled trials?"
Well, they are. Majority of the new medical treatments actually go through, depends on, COVID vaccines, for example, right? And they went through exactly the placebo-controlled randomized controlled trials. Majority of the existing vaccines not just have initial well-controlled trials, they have decades of what we call phase 4 data, which is real world data after it's released. You look to see whether there's safety signals that are rare. And this is what bothers me, I think, because on surface, Kennedy will say things like, we want to restore trust in science, but then everything he says is actually eroding trust in science. He says he wants good quality data, but then when you look at the kind of reports that he cites or data that he puts out, they're suspect, the methodology is not right. There was a report, if you remember earlier in his administration, where there was a question about whether the studies even existed that were quoted in the report. So who would disagree that, of course, we want the gold standard of data? Who would disagree we don't want to, we want to just depend on expert opinion? But it's when those data exist and he denies their existence, it actually feeds into the distrust about why these successful interventions have been in place for as long as they have.
Look, I'm a logical person. You're a logical person. I'm a lawyer by training. My brain can't understand why Robert F. Kennedy Jr. would do things to endanger the health of Americans. And objectively, that's what he's doing. And I don't, maybe I have to talk to a psychiatrist, psychologist for me first, for just therapy purposes, but also to understand RFK Jr. But is it something you've seen? Because maybe this vaccine denialism is something you've come up against. So when I hear RFK Jr. say things, it makes no sense to me, but you understand what's really going on.
Yeah, it's not just Kennedy, right? I would just want to, remark that Kennedy's been consistent his entire life in this belief. He actually believes that vaccines, he's had an issue with vaccines and however misguided we may think it is, and he continues to tout this connection between autism and vaccines, which is not correct. It has been proven over and over again that there is no link between autism and vaccines. But he's believed that, and his belief seems to go back to this 1998 study which is falsified by Andrew Wakefield, who's basically lost his medical license, who falsified data in that study, making that connection. And so he believes it, but there is a bigger trend that you talk about, which is even before the COVID pandemic started, right? In 2029, when WHO listed the top 10 issues in the world for public health, vaccine hesitancy was already one of them. And so it's not just a US problem. We're actually seeing drops in vaccination coverage, and they're twofold. One is this distrust, mistrust in vaccines, partly because I think vaccines have been so successful in parts of the world that people are forgetting that why we need to vaccinate. The second is that it's the pandemic itself had an impact in terms of disruptions in getting global vaccinations to children, for a couple of years in the middle. Most countries have caught up, but there are parts of the world where this hasn't happened. Here in the US, it's not some hypothetical thing that childhood, diseases will come back. It's already happening, right? We have over 1,400 measles cases. 20 years ago, we almost eliminated measles from this country. We have 35 outbreaks, the highest number in 25 years. In 2024, there were 6 times as many pertussis cases compared to 2023. We're seeing diseases come back already, partly because our parents in many of the states, the exemption rates are going up. The parents are exempting their kids from these vaccinations. And the other reason why is that we're seeing this clustering of people who have similar beliefs or distrust in some of the vaccine technology, who cluster together in the same communities, which actually increases the risk of outbreaks, because if everybody around you is unvaccinated, we know that those who are at higher risk for diseases are those who are unvaccinated, who are immunocompromised, or who are seniors. And so you're likely to see outbreaks happen, which is actually what happened in the outbreak in measles in Texas. Was a Mennonite community for a very long time has not used vaccination as a core part of their community, which is where this big outbreak in Texas started. It spread between Mexico and the US. It spread into multiple, states in the US. But what's not helping is that rather than engaging with those communities, or rather than ensuring that they have the information to talk about the importance of this, we're seeing policymakers just basically say, sure, you can do whatever you want. Parents don't have the same kind of data that maybe public health or doctors do, right? I think they're also getting bombarded by all this disinformation from all this fake wellness experts online for social media who will not be there to support you when your kids get sick. They will not be in your corner to say this happened, because they don't care. They don't have to pay like the potential cost of leading parents to off on the wrong path when it comes to these interventions.
And that's a great way of putting it, because they have the social media people love them, and then something happens to you, you can't see social media people, and they're not going to help you out with your bills. So, I was going to talk about this later, but you make a great point right here about reaching out to different communities that might be vaccine hesitant. Have you seen ways that it has worked? And what is the path for that?
Yeah, this is not a novel idea. In infectious diseases, engaging with stakeholders and communities and using messengers that could be most best equipped in sharing that information has always been, whether it's like when you look at polio, or when you look at one of the few diseases we've eradicated, smallpox, right? We've eradicated smallpox, came out of that kind of engagement with communities. It starts with sitting down with members of that community, religious leaders, teachers, those who have influence. The problem is that and so that's still happening. Same thing with HIV. When the HIV, epidemic happened, so much of the organization of the community was engaging with stakeholders in the LGBT community, Q community, right? So it's not a novel thing, but I think what you need to do that is a strong public health system, and you need support for the doctors, and you need a working public health system, and we are gutting our public health system. So good luck trying to find enough public health workers, because when the CDC cuts happen, the CDC budget, huge portion of that actually goes to support states, support state activities, including some of these like vaccination activities. So that's what's needed, that kind of modeling. We use that's used globally. Polio, everything else that we sort of do in terms of engagement, that stakeholder stuff takes good on the ground continuing engagement from people who are from that community. But if you cut the public health workforce in that community, you're not going to have that capacity.
We have to figure out a way. I mean, I'm glad obviously there's a path to do it. I remember during COVID, there were celebrities and different people from different communities speaking to their communities. So that does ring a bell. And I could see that. What's stunning to me, and maybe it's on a personal level, watching RFK Jr. and some of the anti-vax people who you get this sense they think they know a truth that we are too dumb to grasp. If they're the geniuses in the world, I'm not a science person. I'm a lawyer by training, a comedian, writer, all this other stuff. If science was saying in one voice one thing, and I'm saying the other, I'm not the smart one in that equation. I'm the dummy in that equation. Yet you get this sense, it's almost arrogance of them, like, how do you not get this? I'm like, how do you not get it?
Yeah, I'm hesitant about painting the entire group of vaccine hesitant folks into one swath. I
Sure.
think in that population of anti-vaxxers, what we call anti-vaccination advocates, right, are people who actually frankly, just make money off of this. People who want to sell their own product. They want to, they want to not do this. And so there's definitely a portion of people in there who make money from the disinformation. There's a much bigger swath of people who are disenchanted by medical care, by healthcare in the US.
Oh.
They're disenchanted, right? Like with like the ivermectin story, right? Like ivermectin is so popular for apparently everything under the sun. There's no evidence. It's a fantastic study, a medication for parasitic infections. Doesn't work for COVID. Multiple studies showed it. It's now being touted by all these different health promoters, fake health promoters. And it's actually there was 92 bills that actually got put out in 2020 and 2025. 2 states have made ivermectin over the counter. You can go into pharmacies and just buy it like anything else, right? So why are people doing them? I mean, it's easy to say, well, they just don't understand. I think it's more complex. I think healthcare is expensive. I think it's become very complex. There's distrust in the medical system. And then over the last 5 years, we've eroded trust in government. We've eroded trust in public health. So and it's also that our education in terms of natural science and mathematics are not that, we've cut our public health system too. So, I mean, having a population that understands many of these different complex factors around evidence, all that to say, maybe as mad as I am that all of this is happening, I would hate to put everybody in the same bucket, because I have hope, Dean, that there's a portion of people in that group that we can still engage with.
Well, I appreciate your nuanced response to that question. And what I really meant actually was like the RFK Juniors and those guys, some of the leaders, not the ones who are being misled. But I do appreciate that you broke it down, that there is a lack of confidence in government and a resentment of it. And healthcare costs are really high. And people don't want to trust their doctor because they can't afford to get all the medication the doctors say get. But then someone offers them this one medicine they get over the counter. They're like, well, why don't I try that? Because our system is so horrific. And I'm chatting with Dr. Bhadelia, founding director of Boston University Center for Emerging Infectious Disease. Dr. Bhadelia, let me ask you, if somehow studies came out to show that a vaccination that we've been using for a long time is actually bad for people now, like people it's in the Lancet, it's in the AMA, whatever. As a doctor, would you say, hey, we should pause and take a look at this? Something is concerning?
Yes, absolutely. I would look at the methodology of the studies. I think
Right.
ensuring that it's, done by the true methodology. But that's what science is not about belief. Science is about applying same standards of evaluating evidence and seeing if that evidence is changing what your response should be. If that happens, surely we would. But the point is, we're talking about established science where this has already been shown over multiple studies up against anecdotal data. That's what's being shared, right? Or studies that are not methodological valid. That's what we're seeing in this scenario. But science is always about going where the new evidence shows, if it's done methodologically right.
No, I appreciate that. I just did that so the jury would find you more believable. I'm sorry. It sounds like a question that I would ask of an expert witness during a trial, and to show the jury, like, you see, if there was bad evidence out there, this doctor would say there is, but the doctor is telling you there's not, and it's all on one side here. So there was a few articles, op-eds that came out. One yesterday, Susan Menares, I'm not sure if I'm pronouncing it correctly, the head of the CDC, who Kennedy loved, wanted her. She got confirmed and then fired her 29 days in, said, I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric. And that's why she was fired. And she warned that RFK efforts regarding vaccines is about sabotage. So what more can you explain? Can you help us understand what this advisory panel is and what this would have been about?
So this is concerning, right? So there are a couple of things that have happened, particularly around COVID-19 vaccines, but I think they are a harbinger of what's going to happen for, I feel like, with a lot of vaccines and vaccine access in the US. The FDA did something very untraditional where they came out and through basically a New England Journal article and just with their internal experts, decided to change those populations that they felt, that should get the COVID-19 vaccines. So this was the first move that they did, but the interesting thing is the FDA usually decides the safety, and it's the CDC's Advisory Committee on Immunization Practices, which is ACIP, and then decides which parts of the population should get it. So the FDA, had no right to do that, but they did it, fine. What they did by doing that is they said, before this, anybody over the age of 5 could get COVID-19 vaccines, and actually, and in some cases over 6 months. So you have to now anybody over 65 can get it. Anybody under 65 with at least one medical condition, but lack of clarity about what that medical condition is. And this is
Wow.
and there are people, I'm hearing stories about people who are high risk, who are having trouble getting access to COVID-19 vaccines, who would fit into this, right? Because that's the confusion. And our pharmacy is asking those people to prove, like, do you have a medical condition? And they made it so that anybody else, including pregnant women, Dean, who are at higher risk of severe COVID, could not access it because pregnancy was not one of the risk factors listed. This specifically left that out. And healthy kids can't get it. And kids actually, yes, majority of them don't have a severe course with COVID, but many of them still have severe COVID and flu, enough so that it should be made available for those that wouldn't need it. So what they said was, for everybody else, you need to talk to your physician. But think about it this way: you need to have an appointment with your physician. Do you know how I'm a doctor? It's really hard for me to get an appointment with my primary care. I think it's like a year from now, right?
What?
Imagine being a parent,
You have to wait for what? What do you mean you have to wait a year for a doctor?
Just
You're
kidding.
exaggerating.
It's a
Okay.
long time. I'm exaggerating.
Okay. No, no. I'm like, what is going on where you
No,
live?
no, but you know what I'm saying.
It takes me 2 weeks with my doctor, right?
Yeah, it takes a while, depending on where you are.
Right.
I don't know how you're getting an appointment in 2 weeks, but anyways, it takes a while to get an appointment. You have to pay extra money to go see a doctor's visit. You have to transport. We used to be able to get everything at the CVS or the pharmacies or the Walgreens, right? So you've limited the access. By doing that, the FDA has basically limited the access. You now need to prove you have apparently in some places you have a high risk. You can't get it. You have to go see a doctor. And that means that you can't get it at pharmacies and your doctors have to stock it. So effectively, they have limited access to COVID-19 vaccines. The FDA advice was then supposed to be taken by the advisory committee, the ACIP at CDC, and formalized into decisions about who within the population should get it. This is important because that's what insurance companies use to decide who gets coverage for their vaccines. If the CDC were to come out, this ACIP committee, which, by the way, Kennedy fired all 17 members and replaced them with a bunch of people who have proven conflicts of interest because they've previously said that they don't, they've expressed anti-vaccination sentiment. So we know that this is a committee that's no longer completely composed of people who are adequate in terms of their backgrounds, in terms of their qualifications. My understanding is Kennedy basically wanted Monterey to rubber stamp those because after ACIP gets a recommendation, the CDC director has to sign off on it for it to go into effect. So it sounds like she refused to do that. She said, I want to see the evidence, right? I want to see what they're going to say.
Sure.
And good for her. I mean, what was really remarkable is that one of the people who left and resigned in response to that is Dr. Dimitri Daskalakis, who I worked with at the White House. He was the deputy MPOX White House coordinator. He ran the center at the CDC that deals with all respiratory pathogens. He said he has never briefed Secretary Kennedy or anybody at the HHS. Like, they are not talking to their own experts. They're bringing in all these outside people with no qualifications, and they're trying to pass policies that impact people's access to care and insurance coverage. And in response to that, many of the states, like my own here in Massachusetts, in consortia with other Northeast states, and I think some of the Western states,
Yeah.
now started saying, we're going to create our own vaccine policy. You know, great. I think in the immediate setting, we need to do that because we need to preserve access. But what chaos for our national public health system to have state by state policies, right? This is why we have the CDC.
And that doctor, I wrote an article I quoted from his resignation letter because it was very, very powerful. And he made the point, I've never seen this ever. And that he's not briefing, and no one from their area was briefing Kennedy in the 7 months he's been there. And they don't know where he's getting his information, although we can surmise where he's getting it from. There's no doubt about that. That doctor also said people are going to die. Children are going to die. Is that fair to say that people will die?
Absolutely, they're going to die. And moves like the one that Florida did, which basically they got rid of all the childhood vaccination mandates in schools, is absolutely immediately, particularly in the cases of measles and other diseases that are already circulating, we're going to see cases. This is really bad news. Oh, I forgot to add another segment of population in that anti-vaccination group, people who politically gain from it. So it's not money, but they're gaining some power. And I definitely feel there's some politicians who are kowtowing
Sure.
to anti-vaccination for just political gain. And then what a horrible thing to do, I mean, in this situation. Um, so one other thing that Dimitri said, I want to quote him because I think this is so important and it's missed. He recently, I heard him speak about, aside from the insurance thing, right? Everything that ACIP does, the committee does, is there's a program called the Children's Vaccines for Children program, which basically provides vaccination for over 50% of the kids in the US. These are kids who are vulnerable, marginalized, who are in marginalized communities, who are on Medicaid. If ACIP doesn't approve of vaccines for kids under COVID, Vaccines for Children doesn't buy those vaccines. You've effectively taken away the access for over 50% of kids in the US by ACIP doing that. This is why this is so important to Kennedy, enough for him to just go ahead and fire the very CDC director that he hired a month beforehand.
Yeah, and 9 former CDC directors wrote an op-ed in the New York Times this week. And what really stood out to me is they wrote, what Kennedy is doing is unlike anything we have ever seen at the agency and unlike anything our country had ever experienced. And I think that's important. So people understand this is not even close to normal. This is not in the world of normal. This is way out there. There's no defense for this. And Donald Trump praised Kennedy yesterday after his ridiculous testimony. It was like a joke. It wasn't even a real testimony of anything. I mean, what happens if we have another pandemic with these people in charge?
I'm really worried. I mean, not just because this is my part of the world in terms of subjects they deal with, but they basically gutted the OPPR, the Office of Pandemic Preparedness and Response. They've cut multiple sections within the CDC that deal with global health response, including a lot of the capacity to do this exact kind of surveillance, in global communities. And there's not, with all these cuts and lack of clear leadership at HHS or interest. Remember, Kennedy came into this, you and I talked about it the last time we talked, where he said, let's take a break from infectious diseases. Sure, infectious diseases aren't going to take a break from us. That's not how it works. They're not going to wait for the election cycle. I'm very worried about that. I mean, aside from the Ebola thing that I talked about, which probably is not like, it's not a disease that can cause a pandemic, but it can cause local chaos and a lot of death, and potentially we might see imported cases. What if we get an Ebola case of somebody traveling back from that area? I mean, do we have a plan? Who's working on this at the White House? Who's arranging all the agencies, right, to ensure that this is happening? We just don't have I don't have enough visibility to know how effective all of that apparatus is now that we've made all these cuts.
I don't know. Look, what's the bigger concern if Americans, and now it might be more people in the center on the left, don't trust the CDC, don't trust HHS. And with recommendation about healthcare, I mean, at the bottom line, is it talk to your primary care physician, assuming you get an appointment? I mean,
No.
what do you do? What do we do? So what do we do?
Yeah, one of the things that I have seen, sorry, give me one second. One of the things that I have seen that to me kind of blows me away was a statement I believe that Kennedy made that said that you can't trust the experts. Okay, so you have a cancer, but you're not going to trust your cancer. You're not going to trust your oncologist. You want to get your appendix removed, but you're not going to trust the surgeon. I mean, like, how does that make sense, right? Like, I think this effort of saying anybody who's educated and knows anything about this particular topic can't be trusted just seems like a very, again, I think it was like Zeke Emanuel who was on an interview, who was like prior, Obama advisor or something. He said it sounds like almost like Orwellian doublespeak, where,
Sure.
he's like, he says one thing, but he's actually talking about another. Don't trust the experts. Okay, then who's gonna? So my biggest concern is with all these cuts at the federal level, all of this is going to fall on state public health departments, local public health departments. And they themselves have undergone a lot of cuts. And and many people after COVID, remember the abuse that a lot of public health folks got at local and state level. Actually, there was a study that said, 4 out of 10 public health, in some areas of the US, 4 out of 10 public health workers just left, retired early, left. We are under-equipped, we are under-resourced, we are undermanned to potentially do something. So what do? We try to do the best we can, but we need to fix the problem at the federal level. I know over 20 professional societies have called Secretary Kennedy to resign. And we need to have our elected officials listen to what all these professional societies with decades, centuries of experience combined are saying, which is that we're creating chaos both in the medical world as well as the public health world.
I have called for him to resign for what it's worth, but doesn't make any list there. No, but I mean, Senator Warnock yesterday, Raphael Warnock from Georgia, right to his face, called for him to resign and call for Trump. And Bernie Sanders wrote an op-ed a week ago. This is a dangerous man who shouldn't be here. And there are even Republicans like Bill Cassidy, who's a doctor, and Barrasso, who have grave concerns here. Well, Dr. Bhadelia, thank you, my friend, for going through all of this. There's a lot to cover. I didn't think we would be at where we are when we talked in March, and I don't know where we're going to be in a year or 4 months from now or 5 months from now. It's difficult times.
Hopefully better, but oh my God, I can't imagine how much worse it could get.
I know. All right, thanks, Dr.